if you're using innovation and technology, you can build more capacity into an already stretched system. And in the NHS at the moment, we are required to do more for less. And that's why I took the time to nominate this particular team, as I think it's a really good example of how that can be done. I'm really proud of them, and it's something that makes me really proud to work for Steps to Wellbeing, is the innovation and the dedication that the team show.
It's quite flattering, to be honest, to be nominated in that way. It was nice because it came from my line manager as well.
Being involved with the webinar has been something that I felt has been, brilliant, not only for me sort of developing myself sort of professionally, but also the outreach that has had to patients.
The teams that we work with are just amazing. The managers are really supportive, everyone gets on so well.
One of the things that attracted me to the job was the fact that we do work as a team, that IAPT, as much as I was going to stay in IAPT, which is improving access to psychological therapies, temporarily, I've stayed here because actually it's quite dynamic, it's doing something new the world over, and I think we're doing something that hasn't been done before.
But one of the things I noticed is how much respect that the women have that we support. It's a privilege to work with such an amazing woman, really. Once been described by one of the women that we support as an earth angel, and earth angels only come into your life every now and again, and I completely agree. If I could get to a point where she is, that would be amazing, and she continues to inspire me every day. It just needs to be recognised. The world needs to know that this amazing woman exists.
When I found out I was nominated, I was shocked actually. I'm speechless, I guess, which I am now. I felt quite honoured really that someone had recognised the work that I've been doing over the past 16 years. It's a privilege to work with the women that I work with. I feel quite humbled that they share their life stories with me, which are very sad and sometimes really hard to listen to. But I get complete honesty from them, and then you can work with that. You can look at what we can do to help and support them, to move on, to have a better quality of life, a life free of drugs. And they manage to exit prostitution, and they become mothers, wives, and they still keep in touch with me. I find that's really rewarding.
Sure. I nominated Michelle because, as we all know, the Trust has gone through 2 very rigorous CQC inspections. As part of that inspection process, they came to Weymouth CMHT, and unfortunately our clinic room failed twice due to various issues, which was very disappointing. So I felt I needed to have a strong leadership and someone to take control over that. Michelle took on this role with vigour and valour, and she literally transformed our emergency management service to the point where the last CQC inspection, the CQC inspector came back and said that it was an ambassador of good practice. The team value your input tremendously. I value your input tremendously, and I'm very proud to work with you, and I hope you stay with Weymouth for a long time.
It's very nice to get recognition for the changes made under certain areas of Weymouth CMHT. I was very pleased to be nominated, as it highlights the needs of an often underrepresented and forgotten group of patients. What I love about my job is being able to develop relationships with the patients and time that I am able to dedicate to each person. I love receiving their feedback, and it's great to see the huge improvements we have already noticed in their physical health. I have worked in mental health services for the last 32 years, and this post taking me to my retirement has given me so much satisfaction and a spark back in my step.